जिंदगी चुनिए तंबाकू नहीं।
Greetings. Here in this video, we will explain to you how you can care for a patient with wound at home. We can imagine how worried and discouraged you may be feeling because of the wound and the problems associated with it. But do not worry, this video will help you manage these problems. The doctor and the nurse in your hospital may have given you some useful information on how to care for these wounds. Along with that, this video will assist you to manage some of these problems at home. Doing any procedure at home needs preparation. This includes preparation of the surrounding, preparation of the caregiver, and preparation of the patient. Let us look at them one by one. In the preparation of the surrounding, cleanliness is the most important aspect. Cleanliness of the patient and the caregiver and the surrounding is very important when the wound is being cared for at home. Both patient and the caregiver should bath every day. In some situations, the doctor or the nurse would have recommended the patient not to bath every day due to underlying problems. In that case, discuss with your doctor and the nurse and decide the frequency of bathing. In other situations, the patient may be very ill and cannot move to the bathroom. In that situation, you can give bed bath to the patient using soap and a wet cloth. The surrounding should be clean. The floor should be swept every day and mopped regularly. Wastebasket should be kept outside the patient's room. It should be kept closed and emptied every day. Food items should not be left open. We are doing all these things to prevent flies. Because flies are attracted to these wounds and secretions, they can cause infections, infestations, and all these things increase the distress of the patient. Hand washing is a most important step while caring for the patient at home. Following a proper hand washing technique will protect both the patients and the caregivers from infection. To do a proper hand washing, follow these simple steps. First, open the tap and wet your hands with water. Then apply soap to cover all the surface of the hands. Now, rub the palm against each other to generate lather. Then place the right palm on top of the left hand with the fingers interlaced and rub gently. Then place the left palm on top of the right hand with the fingers interlaced and rub gently. Now with the palm placed on each other with interlaced fingers, rub gently. Then rub the back of the fingers against the opposing palm with the fingers interlocked. Now rub the left thumb in rotational fashion by clasping it with the right palm and right thumb. Similarly, rub the right thumb in rotational fashion by clasping it with the left palm and left thumb. Then, with the clasped fingers tips, rub over the left palm in circular fashion. And similarly, with the clasped fingertips, rub over the right palm in circular fashion. Now, rinse your hands thoroughly in running water. Then with a clean towel, dry your hands. Do not use your bare hand to close the knob of the tap. Cover the knob with a towel and close it. Now your hands are safe to care for your family member. If you are caring for a patient at home by giving food through the tube, dressing the wound, caring for the mouth and giving bed bath, you need training. Make sure you have received adequate training from the nurses and the doctors. If you have any questions regarding the care, be sure to ask them. This video will show you how to do some of these procedures at home. Before you begin the care for the patient, self-care is very important. Make sure you eat well, rest well, sleep well, and choose a right time for you and the patient to do the procedure. Do not neglect caring for yourself. If you are taking any regular medicines for diabetes, hypertension, or high cholesterol, remember to take them regularly. Remember, you should not mix your medicines with patient's medicines. You should keep them separately. Do not bend when you are doing procedures unnecessarily, and stay close to the patient as much as possible when you are doing a procedure. Procedures like oral care, wound dressing, and feeding through the tube can be done sitting. So, if it is feasible for you to sit and do the procedure, please do sit and do the procedure. Make sure all the articles are at the patient's bedside when you are doing the procedure. Find a convenient time to do the procedure. Do not do the procedure in a hurry or when you are busy. Remember, you should rest before the procedure and after the procedure. Remember, caring for you is very important. Now let us see how we can prepare the patient. Important aspect of preparing the patient is identifying the right time for doing any procedure for the patient. It is not good to do the procedure at the eating time, sleeping time, and resting time of the patient. It is always good to follow a routine or a timetable so that the patient gets used to the routine and there is no confusion. Make sure you administer the required medicines before the procedure to the patient. Sometimes your doctor would have advised you to administer pain medicines before doing any procedure to the patient. This will reduce patient's pain. And if your patient is suffering from too much pain while doing any procedure, discuss this with the doctor or with the nurse. Explain to the patient what you are going to do before doing and while doing the procedure. This reduces anxiety and facilitates cooperation. Encourage the patient to participate as much as possible. This not only improves their physical well-being but also their psychological well-being. When you care for the patient at home and daily dress the wounds or do any other procedure, there may be waste products like pads, gauze, and cotton that is generated from the procedure. One may wonder how to discard these wastes. All the waste that are generated from doing these procedure should not be discarded along with household waste. They should be burned separately. This concludes the preparation video. Thank you.